Hello there, everyone. This is Rick McDermott here with Senior Solutions Group, and I want to give you a little bit of information here. Toward the end of this month, I will be heading back to DC to hook up with 600 other members of NABIP, the National Association of Benefits and Insurance Professionals. We are an organization about 100,000 strong across the country, dedicated to helping people find affordable health insurance and Medicare solutions. That includes mom and pop organizations like yours truly, here at Senior Solutions Group, to larger organizations dedicated to helping people. And did you know that 3 out of 4 people rely on independent agents or brokers to select or help them select their health insurance needs and their Medicare plan options across the country? So people have been relying on agents like us for many, many years now, and most of our representatives from NABIP have over 10 years of experience, and myself included. We have to get accredited. We have to go through recertifications year after year after year. We are dedicated to help finding affordable solutions for people. So we are going to not only meet with our legislatures, but we are going to network and talk about some solutions that will directly impact healthcare policy over the next several years. One of the things that we're going to talk about is site-neutral payments. What is site-neutral payments? When I was in a doctor's office just last week, sitting in the lab, not getting my blood work done, but having a family member get their blood work done, I noticed a piece of paper taped to the wall that said, "We are an extension of the hospital." So in other words, I'm in the doctor's office, which is actually, they say, part of the hospital. They found a loophole to make hospitals part of these doctor clinics. So imagine if you went to a Coke vending machine and you went to buy a Coke, and instead of having the name Coke on the front of the machine, it said the most expensive restaurant in town bought that Coke vending machine. Instead of paying $1 for that Coke or $1.50, you pay $3.50 for that Coke because this fancy restaurant put their name on the machine. Well, we are going to try to put a stop to these hospitals taking over these clinics and charging you confiscatory prices for a blood draw or for a simple doctor visit. Another agenda item is people on Medicare Part D only have between October 15th and December 7th of each and every year to select their prescription drug plan for the following year. People on Medicare Advantage, which is the private alternative to Medicare, get an extra 3 months. All of January, all of February, and all of March. If your plan changes, which they often do, if your drugs change or the formulary on the drug plan that you're on changes, you have no recourse after December 7th in most cases. We are trying to change that to make it a level playing field for everyone on Medicare. So you have up till March 31st instead of December 7th, if you're on original Medicare, to change your drug plan. Also, plans have been cutting agents out of the equation and steering members or prospective members onto the plans that the carriers or the insurance companies prefer. With all the changes with the Inflation Reduction Act, a number of insurance plans have cut us agents out of the equation. We don't have the ability to help people look at every single plan and be the agent of record for that plan. So we want there to be a deadline of October 1st when people can start shopping for Medicare plans, to when the insurance companies can say, you know what, we're not going to compensate agents for these plans. That will give agents plenty of time to rearrange the deck if necessary. That being said, we often direct people to plans that we don't represent because that's what's best for the consumer. We just want agents to be able to share with our legislatures these concerns that you, our members, have shared with us. We actually sent out a survey, a 5-question survey, to all of our members that we've helped over the years, be able to share their experience in working with us as agents, how we've been able to help them. So we're also going to put a link to that survey below in the comment section. If you'd like to send in your experience working with an agent, you can be anonymous or you can put your name on it if you'd like. So we are here for you. We do this because we care. We want to help shape policy because it's important to you. And if it's important to you, it's important to us. This is something that we are paying for. We are not getting paid to go back to DC. That's how important it is to us. So we're going to give you more information in the future about our trip to DC, so stay tuned. And if you haven't already subscribed to our channel, please do so and share this with a friend. Have a great rest of your day.